Hi and welcome everyone. Thank you so much for coming out today. Today we are talking about intervertebral disc disease. Yes, I've created this interesting little thing here. I'm going to explain this in a moment, but intervertebral disc disease, otherwise known as IVDD, or sometimes called disc degeneration, disc disease, in our dogs. If you are jumping on, please say hello. Let me know you're here, where you're jumping on from, if you're live or catching the replay. My name is Sarah McKeegan. If we haven't met yet, I'm a physiotherapist, canine rehab therapist, but most of all, inspired dog mom, here to bring you tips to help your dog with their mobility challenges. And IVDD is one of the most common back conditions that affects our dogs. And earlier this week, I was talking to a young woman, and it was such a difficult story because her dog suddenly became paralyzed. And if you're here and you're watching, hi Sue, if you're here and you're watching, you're probably impacted in some way by this condition. I'd love for you to share in the comments how it affects you, because her dog recently became paralyzed. And when she went to the Emerge to try and help her dog, she was basically told there was nothing she could do and she should consider euthanasia. And I can't even imagine what that would be like. She basically came home from work and the dog greeted her at the front door, came down the stairs, said hello. It seemed a little bit different, head down, back was a little bit rounded. And when he went to go up the stairs, he moved a little slower. He actually whimpered when he went up the stairs. And she thought, okay, well, something's odd. I'm going to let him kind of sleep it off. And if he doesn't improve in the morning, I'll take him to the vet. She woke up to a paralyzed dog. Can you relate? So obviously she took him to the vet, and basically they said that he was probably too far gone. He didn't seem to have any pain, which was a blessing, but he was probably too far gone and surgery wasn't really an option for him and he would never walk again. And when she said, what should I do? They told her to consider euthanasia. And that's just not the only option, especially for a non-painful dog. And that's how she felt. So she took him home. She was like, well, that's crazy. He's happy. He's himself, except for the back half doesn't work. And after doing the whole Dr. Google thing, how many are familiar with Dr. Google? Let me know if you're familiar with Dr. Google. After doing the whole Dr. Google thing, she ended up reaching out to me and she said, you know, he can't walk, but he doesn't seem to be in pain. He seems like himself otherwise, but I feel like I should be doing more to help him. And she was absolutely right. There's so much you can do. And that's a big part of what we're talking about today, is what you can do to help your dog. And the very beginning of that, I'm going to back us way up, is we're actually going to talk about what is IVDD, or what is intervertebral disc disease. And I know that doesn't sound much fun, but believe me, it's going to be fun. I've got all kinds of things. I got jelly donuts, I got pool noodles, we got pipe cleaners. It's going to be fun. But understanding a little bit about what the injury is in your dog is actually really important. Getting some kind of diagnosis, because it helps us create a treatment plan. It helps you know what the prognosis is for your dog. How well is your dog going to do? What is the most common? Just drop it in the comments. What is one of the most common questions that you have when this happens to your dog? There's two of them that I get asked a lot. The first is my dog in pain? And the second is, will my dog walk again? Knowing what the injury is, instead of just having this blanket term, actually helps you formulate the right plan to restore mobility in their dog, with your dog. And who wants to restore mobility? Just hit the heart button if you want to restore mobility. It might not look exactly the same, but if you want your dog to move again, hit the heart button. Hi, Jeanette. Hi, Catherine. Thanks for jumping on. So we're going to talk a little bit about what it is. And again, I've got a few little slides ready for you here. And if you see me looking to the side, that's just because I have some video to the slide. But we want to think of a disc as like a jelly donut. Now, you're probably like, Sarah, that's a really small jelly donut. I live in Canada. We have Tim Hortons. These are called Timbits. They're the center of the donuts. But The center of this donut is this kind of gelatinous, yeah, I got all kinds of fun things, gelatinous type. So it's kind of like jam, okay, in the middle, and it's high water content. In a healthy disc, there's a lot of water. And then the exterior is kind of like think of it almost like a tire on a car. It's very fibrotic. It's called the fibrotic annulus fibrosus, but it's very dense, tough, and but at the same time has a little bit of mobility to it. And that's what a healthy disc looks like. And then these discs, I had so much fun creating this stuff. So these discs actually sit between vertebrae. So yes, I taped my vertebrae together, but think of the pool noodle bottom, bear with me, as the vertebrae. Those bony prominences, when you feel your dog's back, you feel those bones sticking off the back, the spinous processes, these are the spinous processes. This is the spinal cord. Who likes my spine? Let me know in the comments. Did I do a good job? And the pipe cleaner coming out the sides are like nerves coming out of your spine. There's some more bone and some other stuff here, but for today, this is what we're going to work with. And there's your gelatinous center, and it's called the nucleus pulposus. Anybody want to spell it? And then the fibrotic tissue around the outside, that tough exterior. And that's kind of your healthy disc. And what the disc does is it is a shock absorber. Same with us and our dogs. Shock absorber allows for movement, but also helps to stabilize. But you can see where the disc is in the spinal cord. So what happens when there's a bulge, right? It suddenly presses up against the disc, or the disc suddenly presses up against the spinal cord. So, and there are actually two types of kind of disc problems, I guess you could say. This one is called a disc bulge or protrusion. And I'm giving you some terms only because if you read your medical records for your dog and you see these words, you're like, I don't know what that means. Hopefully this will help clarify some of that. So a protrusion is a disc bulge. So like I said, I had fun. Water balloon. So this is your healthy disc, right? It's nice, symmetrical, round. This is the protrusion. I guess I could go this way. Healthy protrusion. It's got this bulge coming out the side of it. So that's what a protrusion looks like. But and the other thing that happens too is as the discs age, sometimes they get what's called calcified, that they lose some of their water content and the inside gets more solid. So again, remember, jam, jelly-like in the healthy, high water content. Older dogs, older humans, a little bit, you're probably really grossed out, but it gets that, it's thicker, it gets more solid. So in older dogs, that's what's going on. Now, again, with the extrusion, so when somebody says your dog blew their back or ruptured a disc, that's called the extrusion. So the jelly in the center actually comes out. Only it's usually more like our kind of more solid disky stuff. All right. Great model, thank you. Thanks, Catherine. So, and also too, just as we're going along here, if you're watching right now and you think somebody else would benefit from listening to this, or you know somebody else that has a dog with back issues, just hit the share button on this live stream so other people can watch. And please do hit the heart button. It does let other people know that we're live and people are watching. So please hit the heart button, please share this, and we're gonna keep going. So healthy disc, when it ruptures, it's extrusion. A bulge is just that, it's a bulge. Okay, we are going to jump into a couple different types. Stay with me, I'm not gonna go too deep, but again, there's some important factors when we're trying to figure out, what should we do? Should we do surgery? Should we not do surgery? Is my dog gonna walk again? Does my dog have pain? there are certain things that we want to know. So we're going to come over here and we're going to get in the know. And let me know in the comments, let me know in the comments what's going on with your dog as well. So say hi, but does your dog have IVDD, or are you a vet or a physio and want to learn more? Let me know what's going on. So this is what we call Hansen Type 1. And people are like, oh no, Sarah, don't get into the technical terms. Please stay with me. I'm not going to make this complicated. We're still having fun with it. So Hansen Type 1s, these are, I'm going to jump out of this for a second. This is one of the most common types of intervertebral disc disease, and it is most common in our young to middle-aged, long-bodied, short-legged dogs, your Frenchies, your Dashies, all of those guys. It usually happens in their neck or somewhere in their what's called thoracolumbar. So thoracolumbar basically goes from the shoulder blades to just below the rib cage or the neck. And these guys are prone to this condition called Hansen Type 1 disc herniations. And this is the one that's painful. This is, well, they all suck. I'm not going to pretend they're not bad. But this is the one that often has a lot of significant pain associated with it. It comes on really fast. The upside is that the prognosis for dogs with this, the prognosis, if your dog is a young Frenchie or middle-aged Frenchie, is actually pretty good. Surgery is often recommended, but not always necessary, and there's different reasons why we would or wouldn't do surgery. But this type of surgery that is done for this is what's called decompressive surgery. You want to take pressure off the spine. And I'm going to jump out of this for 1 second here. So I didn't mention that before, but there's kind of two different types of injuries to the spinal cord. Basically, it can get compressed. So something pushes up against it, causing compression. No body structure likes to be compressed, inhibits blood flow, bad. The other thing that can happen is what's called a contusive or contusion, fancy word for basically it's like a bruise. Basically, yeah, it's a bruise essentially. So those are the sort of two different types. Hansen Type 1 is a little bit of both, but it is, and again, extrusion, jelly comes out as well. Okay, so that is our Hansen Type 1. And don't worry, I'm going to give you an opportunity. We're going to learn a little bit more because I know you have some questions, and please post them in the comments as we're going along here. So this is Hansen Type 2. Notice I have the water balloon up in the corner there. The sun is there because it's kind of like a, things have dried out a little bit. Again, this is more of a degenerative disc. Nobody noticed my spelling error in there, please. Again, more solidified. And this is the bulge that compresses the spinal cord. The thing about this, so remember I said type 1 happens in our long-bodied dogs, and dogs are usually between the ages of like 3 and 7. Type 2 usually happens in our big boys and girls, okay? And they're older. That's so gonna fall down. Usually in our older dogs. So there's one big important distinction. The other thing is this is usually, type 1 is usually quick, sudden onset. Type 2 tends to be a little bit slower. It can happen over weeks, months, to even years. And one of the challenges with it is if you were to look at it, so type 1 you can actually see on an X-ray often, but type 2, if you were to look at it on like an MRI, you would see or even an x-ray, you would see loss of disc space at probably multiple different sites. So it's harder to diagnose because there's often multiple spots in your dog's back that are affected. So localizing where it's coming from is hard to tell. And there's other things usually going on, like hip dysplasia, elbow dysplasia, maybe your dog has degenerative myelopathy. So it is harder to diagnose. Again, it could be surgical, but often it is managed conservatively. And when I say conservative, as a canine rehab therapist, obviously I'm talking about not just crate rest. And in fact, I'm not necessarily, crate rest is a different conversation, but a proponent of rehab. We do that with people, we do it with dogs as part of that conservative management, as well as supplements and diet and things like that. But that's your type 2. So it's very different from your type 1. They're both these dehydrated discs, but one is long-bodied younger dogs, one is older dogs. It's slower onset as well. So that is type 2. Post your questions in the comments. Hi, Jennifer. Thanks for joining us. Hi, Janet. All right, so let's go. So this is not a common one, but I did want to share it just in case. HNPE, or hydrated nucleus pulposus. I thought I fixed that spelling error. Extrusion. And in this one, I'm going to have to pull up a different slide here in a minute. In this one, it is the center of the disc is actually that nice jelly material. It's not the dehydrated material. It's healthy. And I'm just making sure I have the right information in the next part here. Yes, I did. Good. So it is a nice, it's still that gelatinous material, but it is yes, it's healthy. It also usually does affect older dogs more often. And it's a little bit more common in the neck, which means that the dogs are impacted in their front legs as well. It is very scary because it's often very severe neurologic deficits. But the nice thing is that it does tend to be a little bit less painful than other types of disc injuries. And while conservative versus surgical is debatable on HNPE, and I've been doing a little bit of research on this in prep for today, as well as following the current research that's coming out of the University of Cambridge. So this is new. This is updated info. It is debatable, but these dogs do quite well with conservative management, okay? But this is not a very common condition for our pups, thankfully. This one is, and our poor border collies. So ANNPE is acute non-compressive pulposus extrusion. And this is basically the pressure in the disc. I'm gonna come out of this for a second. The pressure in the disc changes rapidly. And there is, I really wanted to throw a piece of the disc. There is basically a rupture. And if some of that material shoots out and hits the spinal cord at a high speed or a high force, and it's contusive. It causes that bruising of the spinal cord. And this is mainly younger dogs, young to middle-aged, and definitely overrepresented with our poor little border collies. It often is spontaneous, and your dogs will cry out at the time. Some say that it's not overly painful, others say it is, and I've seen it happen, and it is quite painful in my experience. Asymmetrical presentation means it affects one back leg more than the other often. I want to draw your attention here. The only way to manage this, and this is why getting some kind of diagnosis is important, the only way to manage this is conservatively. You can't stabilize anything, you can't decompress anything because it's a bruise, essentially. So conservative management is the only option. All right, and then there is another one that's very similar, yet different, but the presentation is very different, and it's not actually a disc, well, sort of is, but an FCE or fibrocartilaginous embolism is when a piece of the cartilage or a piece of the disc basically breaks off and the blood flow to the spinal cord is interrupted, causing a spinal cord stroke. Often that stroke is temporary and dogs do recover, in my experience, quite well. This is also asymmetrical. Dogs sometimes will cry out, but this one seems to have a lot less pain than the ANNPE. And again, younger dogs that are large to giant breed dogs are more commonly affected. So if you have an 11-year-old golden retriever that suddenly goes down in the back end, it's not an FCE. It's got to be something else, probably your Hansen Type 2, because this only occurs in these younger to middle-aged dogs. And again, conservative management is your only treatment option for an FCE, because again, there's nothing to stabilize or decompress, because it, there was a blockage that has gone away. Essentially, the body will absorb it over time. So you can see why it's important to kind of understand what could possibly be going on with our dog. So we're going to do a quick summary, because I know this is always the burning question for a lot of pet parents. And I'm thinking it's probably a burning question for a lot of veterinarians when dogs come into the clinic as well. I want you guys to tell me, folks, to let me know. We're going to jump out of the share for a second, and just for a minute, Hansen Type 1, okay? Hansen Type 1, which breeds are most commonly affected by a rupture of a partially calcified disc? Put in the comments which breeds are most commonly impacted by Hansen Type 1, which is the extrusion, the jelly squishes out and compresses and maybe bruises the spinal cord, and it's kind of that older jelly. Which breeds? Let me know in the comments. And I think you have this. Dashies and Frenchies. Yes, thank you. Thank you. So right away, you already have a little bit of information there, and it can be managed both conservatively, and that will be a different live stream, and I'm going to give you an opportunity for that shortly. But conservatively, or there's a number of it depends, but most dogs do pretty good, except for in really, really severe cases. Now, when there is an older dog, let's say when your dog has asymmetrical, so hind end weakness or sudden onset of paralysis that seems to be more one side than the other, and they have a little bit of pain, they cried out when it happened, they're a border collie, and they had what's called the ANNPE. Is it usually conservative management or surgical management for an ANNPE? Let me know in the comments. I'll say that again. Border collie, sudden onset, likely an ANPE, and they have a bit of pain. Is it conservative or surgical? Let me know in the comments. You got this. Sue says conservative. She's right. Thank you. All right. Do you remember the type that affects our older, bigger dogs? Our older, bigger pups? This poor guy. Do you remember the type, or even describe it? Is it a bulge or is it extrusion? I'm going to learn how to talk. Is it a bulge or a rupture? So those bigger dogs, bulge or rupture is usually what impacts them. They're older, they're bigger. Right. It is usually that bulge or that disc protrusion. And then we're not going to talk about the HNP because it's not super common, but there are a number of factors just on the, there are a lot of considerations around whether your dog is considered to be a surgical dog or a non-surgical dog. In some of those cases, as we just learned, when it's contusive, it's always conservative management. A quick note on conservative management, that is not just crate rest and medication, that might be part of it, or activity restriction, but early rehab, and this again will be a different live stream, but getting your dog early rehab can make a really big difference in the recovery, because we're working on promoting healing, decreasing pain, and getting, educating the pet parent and getting those legs moving, even when your dog is laying on the back, just in the movement pattern they would use when they're walking. So conservative management, there's a number of things to conservative management. On that note, I want to invite you, we are going to do a live stream Q&A inside Living with Dogs with Disabilities on Tuesday. So I'm going to jump back into this share form for you for a minute. So this Tuesday, if you have more questions, who has more questions? Just let me know in the comments. If you have more questions or you want to learn more, you can just type in more questions. We are going to do a live Q&A on Tuesday evening. Time will be announced shortly inside Living with Dogs with Disabilities. So I've put the link for Living with Dogs with Disabilities. It's our private Facebook community. You can join us, and we're going to do a live Q&A, and we always capture the replay so you can watch later if you can't join us live. So let me know again in the comments if you want to learn more. You can just put learn more. And then also, who wants a PDF? Who wants this beautiful presentation that I put together for you? To help with your learning. Was it helpful? If you want it, just write PDF in the comments and then go up to the description for this live stream. And you can actually, if you sign up here, I will make sure that you get a copy of this PDF. All right. I'm going to come out of the share. So again, you have two things I need you to do. I want you to join Living with Dogs with Disabilities. The link is in the intro to this live stream. And if you want a copy of the PDF, then just sign up there and I will send you a copy of this PDF. And one last thing, if you could hit the heart button and share this live stream so other people can also learn and help their dog, then and being part of that movement of educating pet parents everywhere, so less people go to their vet and be told that there's nothing that they can do. So this is all about helping you help your dogs. Thank you, everyone. You're awesome. I'm so glad you're here. And I'll hopefully see you on Tuesday evening in Living with Dogs with Disabilities. Bye now.